Hello guys, welcome back to my channel Start Life with Physio. Today our topic is optic nerve examination. If you guys have not seen the previous video of the part 1 of the cranial nerve examination, it is in my description box. You can visit to it. So let's quickly begin with the optic nerve examination. Anatomy: the fibers of the optic nerve arise in the retina and pass through the optic foramen to form optic chiasma and then open into the optic tract. Each optic tract consists of fibers from the outer half of the retina of the same side and from the inner half of the retina on the opposite side. So as you can see, this is the anatomy. As you can see, the fibers passing through the optic chiasma, then to the optic tract. Most of the fibers of the optic tract pass into the lateral geniculate body of the thalamus, and we have the optic radiations to reach the visual cortex. Function: the optic nerve serves the most important special sensation, which is the vision. Normal vision depends on the integrity of the visual pathway, that is receptors in the retina, optic nerve, optic chiasma, optic tract, lateral geniculate body, and the visual cortex. Purpose of the test is to measure the acuity of the vision, to measure the visual field, vision color, pupillary light reflex, and local ocular diseases. So basically we do the cranial nerve examination for optic nerve to check following of these fields. First, we have the visual acuity. Visual acuity is defined as a resolving power of the eyes, that is, extent to which the eye can perceive the details and contours of an object. It is measured by distance at which the letters are read, divided by the distance at which the letters should be read. So it is going to be V is equals to small d by d. For this, to measure the visual acuity, we use this chart which is called as Snell's chart. Snell's chart is this chart which consists of letters. These are the patient is made sit and the chart is placed at a certain distance, and the patient is instructed to read the chart. Here a series of letters of varying sizes are present in the chart from top to the bottom, and the letter is visible at 60 meters and the subsequent lines at 36, 24, 18, 12, 9 and 6 to 5 meters respectively. For this chart is known as Snell's chart. So this is how the chart is placed at 6 meters of distance, and the patient is asked to close his one eye and then read the letters. We can also use other charts. Then observation: if only top letters are visible, then the acuity is rated as 6 by 60. Normal visual acuity is 6 by 6, expressed as 6 by 6, 6 by 9, 6 by 12, depending upon the line which the last line which the patient is able to read. It is considered along with distance. Next, for the near vision, test for the near vision, here we are going to use the Jaeger's chart. The image shown here is the Jaeger's chart. For this, the patient is asked to hold the chart in their hands at a certain distance and then asked to read. This is the test for the testing of the near vision. So this is how the test is going to be done. The chart is placed at a distance of 30 centimeters from the subject's eye. Management: they can be myopia, that is short-sightedness. For this myopia, we can use concave lens, and they can also be hypermetropia, which is the long-sightedness. For this, they can be given as convex lenses. Basically, here cranial nerve examination only involves the examination of the nerve. Next, we have the color vision. To check the color vision, the human eye has the ability to respond to all the wavelengths of light from 400 to 700 nanometers. This is called as visible part of the spectrum. The sense of color is perceived by cones. There are three types of cone system: red, green and blue. Mechanism for color vision: the retinal mechanism and the cortical mechanism. As you can see in the diagram, this is the mechanism. To check the color vision, we have this test. For the testing of the color vision, we use the chart which is called as Ishihara chart. As you can see here in the picture, this is the Ishihara chart. It consists of lithographic plates where numericals are drawn in colored spots, and other parts of the different colors and sizes are seen. As you can see here, the color of these plates is such that they are liable to be confused with the spots in the background by people with defective color vision. Procedure: well lit room. Instruction to the patient should be given clearly. Read the numbers or trace the lines in each plate of the book. Maximum 5 to 10 seconds are allowed per plate. Other methods can also be used, like matching colors, matching woolens, etc. Third, we have the visual field. Uh, to check the visual field is the most important method of locating a lesion in the visual pathway. The purpose is to identify the visual field, to detect the position, size, and shape of the blind spot and any abnormality, to detect lesion in a specific part of the visual pathway. This is the test which is done for visual field, that is the confrontation test. Here the patient and the therapist sit opposite to each other, where the therapist and the patient closes their respective one eye on one side. Here the patient is closing his left eye and the therapist is closing his right eye. The distance between therapist and the subject is around 3 feet or 36 inches. Now the therapist places his finger and asks the patient to follow the finger in all the directions without moving their head, just moving their eyes. Okay, now the therapist takes the finger in all the directions, that is from center to right, from center to left, from center to top, and from center to bottom. And after doing this, the therapist can also take the finger in a form of H manner, that is drawing a H in the air, and the therapist is asking the patient to follow the finger where the finger is moving. During this, we observe the movement of the eye. If there is any jerky movement or any nystagmus or any abnormality, that can be seen and observed by the therapist. Next is the pupillary reflex. Pupillary reflex happens, there are two types of fibers, afferent fiber and efferent fiber. Afferent fiber works with optic nerve, and efferent fibers, it is the oculomotor nerve. There are two types of reflexes which can be checked. First is the direct reflex, and second is the indirect reflex, which is also known as consensual reflex. So pupillary light reflex, as I mentioned earlier, there are two types. Direct reflex, a constriction of the pupil of the eye which is directly stimulated by the light, can be seen in the direct reflex. And in indirect reflex, there is constriction of the pupil in the other eye as well, which is not directly stimulated by the light. So this is how it works. As you can see here, when the light is shined onto the right eye, there are ciliary ganglia and oculomotor nerves connection. There is action potentials from the right eye that reach the both right and left pretectal nuclei, because of which there is stimulation of the nuclei on both the sides, and this leads that the right and left side of the nuclei generate action potentials through the right and left oculomotor nerve. This causes both the pupil to constrict. So this is how the pupillary reflex works. Yeah, as I mentioned, when the light rays are on the eye, optic nerve, it goes into the optic nerve, optic chashma, and optic tract, and lastly to the pretectal nucleus. Until the optic tract, we have the afferent pathway, and after which we have the efferent pathway. So this is the procedure of doing the checking the pupillary light reflex. Next, we have the visual body reflex. Here, afferent and efferent impulses both play a role. This reflex is important when, for example, when a person is playing any sports and suddenly the ball is coming towards the person. This is the reflex which plays an important role. This is the reflex where the eye reacts based on the movement or the environment, and because of which there is a movement and safeguarding of the person. Pupillary skin reflex, dilation of the pupil when skin is painfully stimulated by pinching. Afferent impulses and efferent impulses both are seen. They can be visual field defects. Visual field defects can be because of lesions in particular areas. First, we have the unilateral blindness, that is the one side blindness. This can be seen. Then we have the bitemporal hemianopsia. Bitemporal hemianopsia is a visual field defect where the lateral sides of both the eyes have loss of visual vision. And then we have the right homonymous hemianopsia, where there is in one eye there is medial visual field, and in one eye there is lateral visual field defect. And then we have the right homonymous hemianopsia with macula sparing. So this is the visual field defects and location of the possible lesions. All right, by this we come to an end of the topic. Thank you so much. Do not forget to like, subscribe to my channel Start Life with Physio. For further cranial nerve explanation, please visit the other videos on my channel.